Are supply chains ready to handle the COVID-19 vaccine? That is the topic of my conversation today with Julie Swann. She is the Allison Distinguished Professor and Department Head of Industrial and Systems Engineering at North Carolina State University, and she is a member of INFORMS, the Institute for Operations Research and the Management Sciences. Hello, Julie.
Hello, and thank you for inviting me today.
So we have had some pretty good news this week with regard to a COVID-19 vaccine from Pfizer. Things are looking pretty positive. That's good news. But what about at the other end? Are supply chains ready to handle it?
Great questions. And let me comment about that news. It really was fantastic that this vaccine shows that it could be 90% effective, preventing that many cases. So that's fantastic. The state and local health departments around the country have been so these supply chain plans also build on what was done for the H1N1 vaccine distribution. Mm-hmm. And there are many things that they are doing to improve those plans. So they're improving their information systems. They're working on making sure that there's appropriate cold chain infrastructure. So certainly they have been planning for that. There are some challenges, but I am confident that they will be ready when that vaccine comes out.
Well, you mentioned cold chain. Indeed, this is an ultra cold chain. How cold is it? And is this the kind of thing that's been required in previous vaccines, or is this a new phenomenon?
Great question as well. For the Pfizer vaccine, we know that it needs to be stored at negative 70 degrees Celsius. So that is, a deep freeze, more than what you have in your typical freezer. The Moderna vaccine needs to be stored at negative 20 degrees Celsius. So also colder than what we usually have for our vaccine. So in the United States, we have not had vaccines with this deep freeze that was needed, at least not on any kind of widespread basis. And there may be some individual kinds of medical treatments that have needed special cold chains. And so there are a few places in our infrastructure that would have these specialized freezers, although they are not widely available. There has been a vaccine that was rolled out in Africa, a lower cold chain than what is normally used. And so to distribute that vaccine, countries and their partners worked to put in place appropriate infrastructure for that. So there are going to be some challenges related to these ultra low cold chain that are associated with some of these vaccines, but certainly we are aware of that, and state and local health departments and their private industry partners are working on that.
Well, that is a little bit concerning because the scale of the need, I have heard that the initial release is going to require between 20 and 25 million doses, and that is just the beginning. That's just to get your frontline workers and your most at-risk people. Are we ready to scale up? I mean, you're talking about limited infrastructure at a time when we need huge infrastructure. So is it even possible to do?
Yeah, so for several of the vaccines, we will need a second dose to get that full immunity level. That is true of the Pfizer vaccine, the Moderna vaccine. That may be not true of some others. I think Johnson & Johnson only requires one dose. But you could imagine that we could need anywhere from 300 to 500 million doses here in America.
Wow.
To put that in context, when we delivered H1N1 vaccine across the US, we put out about 100 million doses of that. And we do regularly put out 100 million doses or more of the seasonal flu vaccine once a year. Another thing to keep in mind for the COVID-19 vaccine is that it's not all going to come out at one time. We'll see a little bit. You can think of it as a trickle being sent to try to reach targeted priority populations. There'll be a middle phase where it's opened up to some more priority populations, and then eventually opened up for everyone. So this might be occurring over 6 to 12 months. It's not like we'll immediately have 500 million to distribute.
I would imagine there is a strategic rollout plan in place. I mean, obviously, what about geographically? Do you think that the vaccine will be targeted to those parts of the countries that are most at risk and seeing the greatest number of cases? Or is it only fair that each state gets equal access at the top? I mean, how are they going to deal with that?
This is something that's not completely clear right now. For the H1N1 vaccine, it was allocated on a population basis to states, pro rata, as they say.
Mhm.
For the COVID-19 vaccine, it has not been stated it's going to be allocated in that way. There are some places in the language that refers to using disease surveillance to allocate, and it's not clear if that's going to be at the state level or within the state. We do have major differences in how many cases a state has already seen. Take New Jersey, that might have had maybe 30% of the population already had COVID-19. Take another state like maybe North Carolina that's had less than 15% of the population has received, has had COVID-19 already. And then you can also have differences within areas like urban and rural areas.
Yeah. So, but I would imagine to some extent we'll be trying to target it to those people most in need, especially individuals, as you say, frontline healthcare workers, people like that are going to get it first, right? We would hope.
You're absolutely right that those first populations include health workers and some others who are at high risk of greater exposure or greater risk of death.
Mhm.
Now, when you start talking about targeting it geographically, one of the important things is the time frame. While it seems like it would make sense to target based on disease hotspots, one of the problems is that you may not know in time. So by the time you get there, it could be done already.
Right, right. And you may not know who's already infected and the symptoms have yet to emerge, because that could happen within a couple of weeks. You mentioned the regular flu season vaccine. I imagine a good amount of those supplies have already been rolled out and are currently now in healthcare centers and hospitals. But is there any possibility of conflict? Might that have to make way for a COVID-19 vaccine, or is this year's supplies of the regular flu vaccine already in place?
Yeah, I think the majority of those supplies are in place. They distributed it a little bit early this year. I know it was available in August where I live. So far, we have, uptake is high, but we haven't seen everyone get vaccinated yet. I think I heard recently that maybe 40 to 50% of a particular population had been vaccinated. We'd really like to get to more like 60, 75% so that we also reduce the chances of co-infection and things like that could lead to hospitals being overwhelmed. So that flu vaccine is still out there. And what is true is that it could be that some people get a little bit confused on which vaccine they might have had and whether they're protected against one disease or.
Yeah, you wouldn't want them to think that having gotten just a regular flu vaccine, that suddenly they're protected against COVID-19. Certainly that would not be the case. So, I mean, more confusion added to the fact that we now have a new incoming presidential administration who's just got boots on the ground coming up on this week with healthcare professionals who are making plans. Do you think that's going to alter in any way these plans that we've been talking about, to the extent even there were plans before? Do you think that this is going to change the strategy in any way?
Well, the major core of our supply chain plans are really based on what was done in H1N1. And that core, I think, will not change. And President-elect Biden was the vice president when that H1N1 campaign happened. So that, his administration would have seen that. So that's not going to change. We could see some other kinds of changes in how vaccine is allocated, in some of the messaging and communication, a variety of things that could happen over time. And it could be a little confusing because we have the current administration still in place, but an administration doing their plans and their messages are maybe not always the same. So we'll have to see what happens over the next weeks and months as that starts to roll out.
It's interesting because you're describing a lot of stuff that does raise concern, but I feel like the tone of your message is one of basic optimism. It sounds, are you essentially saying we're gonna make this work one way or another, or do you have deep concerns about our ability to get this vaccine distributed in a timely fashion?
We will see some glitches. We will see some delays in the process. We will have some places and points where information may be confusing. But in some ways, the H1N1 pandemic was a bit of a test of our system. We ran a major test of the entire system and put out 100 million doses in a relatively short period of time. So that's the good part. If we hadn't had that already, I would be more worried. There are some areas in which I do have some current concerns. I'd like for us to continue to look at the data on the vaccine safety and making sure that the production system is reliable and consistent. I'd like us to be continuing to look at our information systems, making sure that they can talk to each other and making sure that the appropriate information is reaching consumers who need to know where to get vaccine. I'd like to see some more details on what those allocation strategies are and how transparent that they will be both to states and to the public. There certainly are some opportunities for improvement, but on the whole, I think that we can get the vaccine out there. And the really, really big challenge was finding a vaccine that works. And so far, we've seen at least one that's showing some really positive numbers. There are others in development that I think will come along pretty close behind the first one. So I project that we will have maybe 3-4 vaccines that are available in spring of 2021, which also gives us more flexibility in the distribution system and getting some things to urban areas, some things to rural areas, some things for the population of elderly, some for younger populations, depending on what's most effective. So there are going to be some challenges, but we also know something about.
Julie Swann, I want to thank you so much for kind of outlining the challenges of distributing a COVID-19 vaccine, a very realistic view, and yet also upbeat and optimistic. And we could sure use that kind of good news right now in terms of getting this thing under control. Thanks, Julie, for talking to me today. I really appreciate it.
Thanks so much.